The rapid spread of COVID-19 has presented hospitals and health systems with the greatest public health challenge in recent history. As they work to provide safe and effective care while combating the rise of the disease, many providers are turning to digital tools to help scale their response. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Verily, senior writer with AHA. In this podcast, Andy Shin, Chief Operating Officer of the AHA Center for Health Innovation, discusses what digital response strategies have been successful and what lessons have been learned with industry leaders from AVIA and Verily.
Hi, I'm Andy Shin, COO of the American Hospital Association Center for Health Innovation. Over the past few weeks, our nation and the world has been battling an unprecedented public health crisis. It's called on hospitals and teams of nurses, doctors, and other first responders on the front lines to make nothing short of heroic efforts to tame this pandemic and care for our communities amidst COVID-19. So we're taking a moment today to develop this brief podcast as part of our overall effort to rapidly share best practices so that we can equip our hospital leaders with every possible tool and strategy. And frankly, even 24 hours of saving time in this situation could be meaningful due to the pernicious nature of this virus. I want to thank two healthcare leaders who we've been working with over the past few weeks for sharing their insights and to talk about how hospital leaders can and are implementing digital tools to gain any sort of advantage right now. Bruce Brandis is General Manager, Digital and Partner Network for AVIA, and Vindell Washington is the Chief Clinical Officer for Health Platforms at Verily. Bruce and Vindell, thank you for taking a moment during this emergency to help our colleagues who are on the front lines. We've worked with both of you to introduce new tools that will hopefully help, and we definitely want to talk more about those, but first want to talk strategy. So let's get right to it. Bruce, what are you hearing right now from the field? How are hospitals successfully deploying digital strategies to fight COVID-19? Give us a common framework.
Thanks, Andy. Appreciate the opportunity to share this. We're working with about 55 health systems across the country and have seen some common themes in terms of how they're approaching and organizing their digital strategies specifically for COVID during this first phase where we're dealing with this surge of clinical issues and other issues related to COVID. And there are really three areas around which they're organizing. One is adapting the clinical care delivery. The second is adapting their operations, their underlying business. And the third is preparing for and serving the community's needs and coordinating an array of the needs, particularly for those in a vulnerable population. And underlying that are a number of different action areas that they're taking, digital capabilities that they're deploying, which we'll get into. But ultimately, it's to support those three broader areas.
Vindell, does that resonate with you? How are you seeing hospitals within that framework, perhaps making some headway?
Well, I'd add my thanks as well to Bruce for you allowing us to speak today. I would say in our discussions with folks, the thing that struck me the most is really the sort of dedication and poise that folks are displaying in this time. And I have a great admiration for the providers on the front lines, and so I'll add my thanks to yours as well to the work that they're doing at this time. I would say my gestalt is pretty close to what Bruce had said. I would also add that the responses are pretty varied in how people are using digital. I think as an emergency medicine physician, my disaster training goes back to this construct of the first three things you should pay attention to is communication, communication, and communication. And so I think that's been a major theme we've heard, whether it's around getting information out to the public, getting information to their providers, trying to help preserve their ability to care for folks in the system because of the risk of being overrun by demand in the system, and so getting people information about what they can take care of themselves at home have all been really front and center. And I'll also add that this construct of rethinking care delivery has also been really present, where there are a lot of efforts to direct and provide care through means that are less utilized in times other than this pandemic, virtual care being the main one. But the punchline I would sort of put on this is that the opportunity is great across the board, But even the most sophisticated and advanced systems that we are talked with have noted that there's some work to be done in really fully realizing the potential of digital at this time of need.
Yeah, that's such a good point, Vindell. I think everybody is, no matter where they might be in terms of digital infrastructure, learning a lot of lessons. And I think that we mentioned in the beginning in my lead up that time is really the one thing we don't have right now. So Vindell, from your experience, how are people saving time? What are some of those quick lessons learned just in the past few weeks that you're seeing to help save some time?
Well, the one thing I would say is that the folks who are managing their time best, in my opinion, are recognizing that the efforts really have to be prioritized and recognizing that often it's a community effort that is required. So it's probably not the ideal time to spin up completely new efforts around programming and development and marketing and design and those kinds of efforts, recognizing that there is help, there are infrastructures that could come into play and support, taking advantage of some of the easy to implement and free tools that sort of are popping up in the community reach outs. The other piece is just recognizing just the great trust that the community places in hospitals and their clinicians, and just amplifying their voice in that space. I think it's been really both something that draws the community together and provides great services to the folks in addition to the direct care that's being provided. But I think mainly it is to think about this from a community perspective, and the hospital or health system across town that may have been your competitive rival is now in the same fight that you are, and that those silos breaking down is, I think, an important way not to spend effort in areas that are not directly yielding great feedback at that time.
It's such a good point. The level of partnership and cooperation is essential if we're going to get through this. Bruce, from your perspective, what are some of those lessons learned that you're seeing just even in the past couple of weeks?
So building off Vindell's points, I think right now everyone's looking for how do we deal with this first phase of this pandemic, which is the surge in which we find ourselves today. We also have to recognize that there are going to be other things that we'll be doing as we move to the next phase of this into the rolling recovery, and then ultimately we'll be on the back end of this, having survived it and finding ourselves in a new normal. But what I'd like to focus on is specifically what we're seeing during this surge period. What are those quick, no regret moves that you can make, and to Vindell's point, that are quick and free or low cost that can be implemented in a matter of days. And we see 6 areas where people are acting or have acted that have reaped real benefit quickly. The first 2 really fall under the umbrella of taking leadership position for education and information. The first is to have automated texting capability with your patients to make sure that they stay informed in a consistent way. Secondly, we find that chatbots for the community on the health system's website is a great way to be able to engage and disseminate the right information and be able to get the community as a whole up to speed. Then there are a few areas that are falling into the category of clinical care that are really easy to implement. AI-driven symptom checker, for example, should be a part of everyone's toolkit. Having the ability to do asynchronous telehealth visits to help offload the capacity challenges that everyone's faced with right now is something that can be done very quickly, and a lot of the regulatory restrictions that might have slowed its adoption in the past are alleviated for now. So we're seeing a lot of progress with that. Fifth, we're seeing people really leveraging remote patient monitoring and bring your own device types of apps to be able to empower people to take home to continue monitoring them and their symptoms and conditions. Finally, the 6th tip that we've learned is one that pretty aggressively to deal with the capacity challenge, health systems should be, if they have one, they should be turning off their online scheduling capability to avoid those worried well from clogging the system. And I think that those 6 moves is pretty consistently bearing a lot of fruit and benefit in a really quick and easy ways to make a difference in the communities that you're serving.
Yeah, and what's interesting, Bruce, is that those categories clearly go beyond digital in that those are things that we should be thinking about in Surge and are. But what is relevant here is that I think digital has really been able to help accelerate our ability to actually tackle those categories and those issues, which is really sort of the opportunity I think that we're seeing right now, especially with the proliferation of free or low cost tools that are being deployed in the field. But some of these health systems and hospitals are at different stages of their digital journey. And so for those who may not have had as much investment in their digital infrastructure, don't have the time obviously now to just start from square one, but you just gave us 6 really important categories. Where do they start first, especially for those folks who have not had a very mature digital infrastructure already?
Indulge me just for a minute. Think back to 3 or 4 weeks ago in a pre-COVID United States. I know it seems like it's a lot longer ago than that. It may be hard to remember that far back. But pre-COVID, a lot of health systems were very early or very reluctant to understand how aggressively to move in terms of advancing their digital maturity. So there was already a great variance. A lot of health systems were kind of knew that they needed to be doing something with digital, but didn't know how to prioritize. They didn't understand with all the noise in the market, what moves the needle and what doesn't, and where do I stand compared to my peers, because I have made some investments, but I'm not sure if they're good or not. What does good look like? And so that was the issue pre-COVID. Then you throw in the frenzy and insanity that we're dealing with in this storm that we're dealing with COVID now. It really only exacerbates that challenge. So to really understand where you are, I think is the first thing, to figure out what are the things that scale. How do I leverage current investments that I already have? Most every health system has an electronic medical record. Most of them have invested in different digital capabilities, whether that was explicitly part of a broader strategy or not. They already own existing assets that can be used. And so how do you take what's working in pockets and figure out how to scale that system-wide very quickly? And I think that's really the first order of business, is to take an accounting of what you already have and what's easily available to you that you can get scale with quickly.
Yeah, and I think every hospital in the country has a website, right? And so, Vindell, I know you all are working with something that can be embedded right there. But sort of similar question, Vindell. In terms of prioritization, what's your opinion on how you start to pick what do you do first if you can only do a few things?
I really like the framework that Bruce set up, and I think that's the way a lot of the thought leaders are thinking about the pandemic. I would say that we are, in our conversations, listening to the needs as identified by frontline providers, and because they're different parts of the country and different parts of this cycle of pandemic, we think listening in that way is helpful in directing the order of march and how priorities are done. I would say we've noticed or at least plotted out and noted a 4-step kind of flow of needs. I think the first one has been underscored already, where there is this surge of activity, and many providers are thinking about this and thinking about their digital solutions and their ability to not be overwhelmed by the worried well or the walking wounded. And so folks who could take care of themselves at home are not really affected to a significant degree. How do you manage that flow? And there's some tools that come from there. I think the second construct around call centers and the usual areas of connection, people are investigating ways to decompress that, and whether that is with the triage and tracking tools that are present or the chat box that Bruce mentioned. I think after that initial burst, there's this concept of how to deal with what's in the community, but what has not crossed the doorsteps of providers. So some ability to do some symptom management and tracking. And also that symptom management and tracking really is not just the folks that are in the community that are patients. It's really the healthcare providers. I think unlike other disasters, we're in a situation where providers are also really affected by the pandemic themselves. And so it becomes an employee and a workforce construct, particularly as we move forward, to make sure that folks are being tracked appropriately and that there are good ways to keep that care team available for their members. And so you'd mentioned what we were thinking and deploying in terms of a free service around tracking symptoms. We're also looking at ways to address frequently asked questions and using chat bots and voice bots in that space. The whole construct around that is to say, in that first phase of the pandemic, there's a pressure around responding to the demand in the community, and matching that demand is sort of critically important. The symptom tracking, I think, is another area of focus for us, where we think that analysis, and particularly being able to predict the demand on systems, is critical, both for prediction and demand forecasting. And we think that that constellation of efforts is going to be required for a while. And I think in terms of the initial question around prioritizing, it really feels to us that you have to meet folks where they are in that cycle, and you have to be delivering those tools. And I think several of those tools are really going to be important as we work our way through the pandemic.
Yeah, you talk about employees as and the workforce, and I think that as members of the community as well, right? Because our employees are serving their communities that they live and work in, and so I want to talk about tools. So maybe if give us some insight, Vindell, on and when you think about community, what type of community organizations are you or are you seeing hospitals think about in terms of partnerships or integrating as part of this strategy? And then, I think it's a good time we said we're going to talk about tools. I would love for you to just talk a little bit about Verily COVID-19 Pathfinder, because I think it's a really important tool that you all are offering for the field.
Yeah, your point about the community connections, I think, is critical. We certainly worked on specific partnerships with local government, with state government, particularly in the California area, around testing and trying to make sure that assets and resources were available to folks there. And so we do think it's important to think about it as an ecosystem: public health, government, care providers, and the community all being connected, and there being a need in this time to sort of work across those platforms. I think as our contribution, we also went directly to your second point, which is the COVID Pathfinder. What are the symptoms that folks have, particularly as the exposure goes up for everyone in the country? What are the symptoms that people have, and what should they do with that symptom complex? So obviously there's a set of those symptoms that mean you need to seek care right away, and that's very clear. We've also thought that there need to be some customizable strategies, because each community will have different assets to bring to bear. So one of the things that we've engineered into our tool is the ability for health systems, those trusted community care providers, to say that if you fall into a certain symptom category, that you will have specific directions on where to go. So we think the heavy lifting of doing the CDC translation is a contribution that Verily can make, as well as the software platform, and using our stance as an alphabet family member to be able to do things like provide that information in several different languages, back to that concept of communicate, so that folks really have good information on where to go in those communities, and that it is easy and straightforward for them. And so our goal is to make that available to AHA members across the country, health systems and hospitals across the country, to use as an easy embeddable tool on their website to help people know where to go. And then we think that beyond that, there are other enhancements as this goes along, with the whole idea being we want to take the burden off of health systems of having to do this daily translation of CDC work, this daily language translation, and making the IT lift easy, because we know people have IT resources that are setting up field hospitals. They have IT resources doing lots of things that are critical for them from an infrastructure perspective, and we think that we can contribute in the Pathfinder distribution to take that level of burden off of members.
Thanks, Vindell. And I think that the Pathfinder tool from Verily is going to be a huge for the field. And thank you so much for the partnership on that. I want to turn it over to Bruce, because Bruce, one of the things that we're seeing a lot are folks who are saying, we're doing all this rapid response now, we're adopting digital tools, but I think one of the questions that we see hospital leaders asking themselves every moment they can is, we're trying to make sure that we're not doing this right now and not also setting ourselves up to be ready for the next pandemic, for next season, or for whatever may come. And so thinking about that short to long-term strategy, and I think that ties into the tool that we've been working with you on at AVIA. So would love for you to talk a little bit about that, especially in the context of what does this pandemic response mean in terms of long-term strategy?
First of all, I think framing this, as I described earlier, thinking of right now we're in this surge period, but this will lead to a rolling recovery period and then to a new normal. So as you think about all the digital needs that you have, not only today in the surge, which we discussed some of those, the reality is you want to make investments not only in things that can scale today to help you with the surge, but also things that are going to be durable, that will serve you well post this crisis in the new normal. And so, how do you make sure that you're making the right investments? And there's even pre-COVID, there was a lot of noise in digital health, and certainly during this moment, the level of noise that needs to be filtered has been significantly amplified. And so together with AHA, we've delivered and made available to every AHA member a free tool that we call the AHA Digital Pulse, specifically for COVID, although this actually opens up the door to a whole bunch of other assets that will serve beyond COVID. But what we really wanted to be able to do is help people to understand, based on wherever you are on your spectrum of digital maturity, to be able to go in and assess the different categories that I described where people are acting, to understand the specific areas where I can implement, where I can take action, where I can change a workflow, where I can think about where digital can make an impact, to understand where those are and specifically where my organization is and what good looks like, so I can learn not only where we are, but compare that to our peers and then get benchmarking data back, not only to assess where I am today and direct me to the tools, the resources, the knowledge tiers that I can share with to help to be able to advance my journey once I understand where I need to go. So we would encourage everyone to understand how to use this digital pulse today specific for COVID, and know that it is an ongoing resource that will be available to you with a whole lot more beyond COVID to help to inform your digital strategies. So the investments you're making now and the investments that you have made are scalable and durable and sustain you through the rolling recovery and the new normal that will come on the back end of this.
Thanks, Bruce. And we can find both those tools right on the AHA website. If you want to go directly to those tools, it's in our digital response page, which is you can link from the homepage of aha.org/center, or you can get to these tools via the overall and all other COVID-19 resources from the COVID-19 resource page on aha.org. So I want to wrap it up because time is short, but one last question so that I have both of you on the line. Just wondering, what are we learning now? I know we're only several weeks into this and we have a ways to go, but what are we learning today that's going to help us in the future, whether that be 2 months from now or a year from now? Maybe start with you, Vindell.
Well, I would say one is just that we should be really vigilant, that thinking about this current pandemic, we should be thinking in terms of months, not weeks. Our experience with past new flu strains really dictate that we should respond now aggressively as we are, but that we should also be preparing for the upcoming October flu season. And even though we hope for early treatments and vaccines, their appearance in a short timeline would really be unprecedented. So take advantage of testing, use AI and prediction models where available, quarantine and self-distance early. I think those are all lessons learned that we should continue to deploy as we go through the next few months. I think this concept of public-private relationships and being more interconnected with communities and resources is also a lesson that we should continue to act upon, really remembering the importance of community. And I think that really there are lots of good resources that are available for folks. And so You'd mentioned the AHA website and others where people can go. The CDC, WHO, I think, are often good places for people to get information. That won't change over time, and I think really having connectedness there is really important.
Thanks. Bruce?
One thing that's really clear is there will be some good, albeit painful in the process. There'll be some good that comes out of this pandemic on the back end if we do this right. There's been more to happen in the last 2 to 3 weeks to advance the adoption and awareness of digital solutions and their impact that they can make in the delivery of care and how health is managed than has probably happened in the last 2 years, 20 years. Actually, in fact, several of our members have made that comment that because of loosening of regulatory constraints and traditional decision-making frameworks, they're able to move really quickly and deploy things, and they're actually seeing the benefits of it immediately. So I think that you're going to see a couple things that come on the back end that will be enduring as a result of this. One is, I think it's very clear that on the back end of this, they're going to be very empowered consumers that will have different expectations for their health systems. I think we would all agree that telehealth, the consumer awareness of telehealth and a lot of the regulatory restrictions that have limited its full adoption previous to this have now been alleviated, and I think you're going to see telehealth as a core component of health. And other capabilities like remote monitoring, particularly for those who are chronically ill, the ability to care for people at home. I think you're going to see consumers expecting all of that, and we as provider organizations need to really lead with efficacy and urgency around those that are making a difference and that will endure. The other dimension, in addition to empowered consumers, that I expect is going to happen, because we're so busy right now, we're just now starting to think about what the resulting financial impact will be on the health systems that are providing all this care, that are suspending a lot of other activities right now. And I think that in addition to the cruise lines and the airlines, you're going to find a lot of health systems that are going to have a whole lot of different types of needs financially on the back end. And I believe that there's an opportunity for digital to be part of the new normal that makes it more financially viable for them to deliver the services that they'll need to deliver in the future. And I think that that's something that will be studied once we get out of the crisis. But I do know that there are telehealth, for example, there are a number of technologies that we're deploying today that will be good business for health systems in the future if we do it right. And so I think the key is understanding all these different digital solutions and approaches and strategies and being very intentional, learning from our peers so that we can move faster and with less risk and more confidence. And I think that on the back end of this crisis, as painful as it is right now, we will have a better health system as a result.
Well, I really appreciate those insights, Bruce and Vindell. And to all our colleagues out there, we support you. In our nation, every town and community stands behind you and with you to get through this. And I know that I speak for all of us when I say that we will not rest because we know we can't. So with that, thank you.